pressure exerted by the blood on the arterial system. Heart is a pump. It exerts some pressure by pumping it into the circulation. That particular pressure is called as, ideally it is causing the effect, a rippling effect all over the body, and that we measure in the arms and legs, called as blood pressure. Ideally, the blood pressure should be 120 over 80. Upper, that is systolic, we call it. Upper blood pressure is called as systolic blood pressure, which is 120 over 80. 80 is the diastolic pressure. So anything above 140/90 is abnormal and is called as hypertension. There is a second category of blood pressure called as systolic hypertension, in which the blood pressure is upper blood pressure is 160 and lower blood pressure is 90. Systolic. This second variety is usually seen in people over 60 years of age. So called as isolated systolic blood pressure. As I mentioned you, the high blood pressure means anything which is above 140 over 90. And if the blood pressure is normal blood pressure ranges from 90 over 60 by 120/80. If the blood pressure is less than 90/60, 90/60, that is 90 systolic and 60 diastolic, low blood on the lower side, then less than this is called as hypotension or low blood pressure. Blood pressure is a very silent killer, like diabetes. Nobody is aware. Some people are not aware that they have diabetes, and they are like hypertension. They are not aware. So there are no symptoms. Patient is very happily moving around. At times he gets some headache or some discomfort in the chest or palpitation or lightheadedness. But if the blood pressure is sustained and if there is a trigger to increase, trigger like stressor, then the blood pressure can precipitate heart attack, can precipitate stroke, we call it paralytic attack, or brain hemorrhage, or kidney damage over a period of time. So it has a multiple organs involvement. It targets every organ of the body. So these are the common things, couple of things which are commonly affected by the blood pressure. Most all the organs are affected, including eyesight. There is blurring of vision. Patients they first come to us, our consulting room, that, "Doctor, I am unable to see properly with my left eye. Probably I have developed cataract. I may be having, but he has a hypertensive retinopathy." So that is how it is diagnosed. Sometimes it is diagnosed when the patient is brought in unconscious state and we detect that there is a hypertension, blood pressure is 180 or 120, which is very high, and patient's brain has, there's a bleeding in the brain due to severe blood pressure, high blood pressure, and or they will come because, as I told you, it is an asymptomatic disease. So they will come over a period of time with the kidney failure symptoms. They will come with the raised creatinine levels. These are the kidney parameters, or they will say signs of urinary failure, kidney failure. These are things which they will come for. That is a very difficult or simple, difficult to understand and simple to explain. But difficult is the sense, if your hypertension is not under control, then you better take blood pressure instrument, purchase it, and monitor your blood pressure at home twice a daily, and keep a record of it, and show it to a physician if the blood pressure is, how the blood pressure is behaving. Suppose some people say the blood pressure in the morning is normal, but in the evening it rises. Some people experience this blood pressure rise when they enter into our chamber, called as doctor's chamber, white coat blood pressure. They are so scared the doctor will detect something and I'm sure going to have something. So they are more scared of that. That is called a white coat blood pressure. Okay. And once you have a blood pressure, then you need to monitor naturally. If your blood pressure is absolutely under control, you are very sure, doctor is very sure that this particular pill is working on you, then you can take it after 1 week, or randomly you can take 2 weeks time. But regular checkup of blood pressure, if there is symptoms and if there is some event which has occurred, then you should better monitor it. It's a harmless thing. If you can monitor it once a day, then it's okay. And you have a regular checkup with doctor, initially with once a month, then after 3 months, and after 6 months, according to your condition. But blood pressure monitoring can be done, that is called a self-monitoring. device. If the blood pressure is uncontrolled, not being able to control by any means, and doctor is also not sure, then we put up an ambulatory self-monitoring device. The blood pressure is monitored 24 hours. The blood pressure is monitored throughout your day and night for a couple of days, and then we keep a record of that. Sometimes something like that blood sugar monitoring these days, we can keep it for 14 days on your shoulder, and blood sugar is monitored every second. And that record can be kept in the machine, and that can be monitored by the patient as well as by the doctor. Similarly, the blood pressure can be monitored by keeping a machine there, and we can judge the pressure whether in the midnight or night the blood pressure comes to normal, but when he gets up, he becomes more anxious, he's active, and the blood pressure starts rising. So that is how it should be. So there are multiple modalities by which we can do it. A regular checkup with doctor, check your blood sugar, check your blood pressure, check your cholesterol, lipid profile, check your kidney function test, check your blood sugar level like A1C levels. These are the things normally done. If you are symptomatic, then echocardiogram and the stress test and other parameters. If you have a apparent heart disease, then you should do coronary angiography. Coronary angiography, that is an invasive procedure done in the cath lab, and other like CT angiography or MR angiography can be done in select cases. So there are things which can be done. Whenever he's symptomatic, if he's symptomatic, yes, then he has to go to the doctor and see. If he has a problem, he has to go and see and consult him. He can go to any nearby physician, check his blood pressure, check his blood sugar, and if required, they can recommend a couple of tests on him or her and let them get checked up with the nearby pathology laboratory or the cardiac laboratory, whatever it is. They have to be proactive about their problems. Anything which is rich in sodium, it will shoot up your blood pressure. And if you are obese, if you are overweight, try and reduce it by doing exercise, eating less food, and don't go on crash diet, okay? That is not advisable. And if you have a associated diabetes, control your diabetes. If you have a kidney disease, then you should better be cautious about your liquid intake as well. So these are the things which are basically an alcohol intake, and is also should be restricted, especially if a person is addicted to alcohol. So he should restrict it to 2 pegs if he is a male. If he's a man, if he's a female, a lady should only have 1 peg. I don't know what is the cost of this, but this is what has been recommended. So you should restrict that. One good thing about this is that food intake, especially the fatty food intake, fatty food fish, that is tuna or salmon, is recommended. And dark chocolates are recommended, and red wine is recommended. So you can have that. Anybody can have that. Not in plenty,